Hi, my name is Gustavo Lopez. My topic is antibacterial envelope to prevent cardiac implantable device infections. Definition. It is estimated that 1.5 million patients receive cardiac implantable electronic device, CIEDs, worldwide every year. Despite the use of various antibiotics, prophylaxis regimens, and advocacy of best surgical practices, the infections after placement of CIEDs remain major complications and are associated with substantial mortality, and healthcare utilization. An absorbable multifilament mesh envelope, TYRX, absorbable antibacterial envelope, Medtronic, is available to improve CID stabilization in the subcutaneous pocket and to elute the antibiotics minoxidil and rifampin.
Number 7. Antibiotic envelope for cardiac implantable device infection prevention.
Pacemakers and defibrillators are life-saving electrical marvels, but do not come without risk. Infections occur in 1 to 4% of cardiac device implantations and can lead to a 25% one-year mortality rate. Treatment costs average around $60,000. Until now, giving the right antibiotics right before the procedure was the best and only proven way to prevent infection. Despite this, infections continue to occur. The recent innovation of an implantable antibiotic envelope ensures delivery of 2 antimicrobial drugs locally in the pocket for 7 days after implantation surgery. The week-long release of the drugs minimizes the risk of infection. The absorbable envelope received FDA clearance in 2013. But healthcare professionals were awaiting results from the landmark worldwide randomized RAPID trial. The findings, published in March, show a 40% reduction in major infections, making cardiac implantable device procedures safer for patients.
Applications in medicine. The TYRX envelope is an absorbable single-use envelope designed to hold a CIED when the device is implanted in the body. The envelope is constructed from a multifilament knit mesh and coated with an absorbable polymer mixed with minoxidil and rifampin, which elutes the antibiotics into the local tissue for a minimum of 7 days. The envelope is fully absorbed in approximately 9 weeks.
The pilot study was presented at last year's late-breaking session. It was a multi-centre study that randomised patients undergoing device surgery to either standard antibiotic regime against an incremental antibiotic regime with a primary outcome of device infection. The result was that the extra antibiotics did seem to reduce the rates of infection, but just missed statistical significance. The follow-up study that I'm presenting tomorrow looked at independent predictors of infection and then took those independent predictors and created a clinically meaningful risk score so that we can calculate individual patients' risk of infection.
And so what does the score look like? What are the elements that are used to create it?
Yeah, there's 5 elements to it. Age is the first one. Age, surprisingly to us, goes in the opposite direction to what you might think. Younger patients are actually at a higher risk of infection. Number 2 is the procedure type, meaning pacemakers have the lowest risk, ICDs have an intermediate risk, CRT and revisions, etc., have the highest risk, immunocompromise, renal dysfunction, and finally the number of previous procedures on the pocket is very important. You get 1 point if you've had 1 previous procedure, and actually 4 points if you have had more than 1 previous procedure. 5% of the the population had an infection risk score of 7 and more, and those patients have a risk of infection of about 4%. Our own centre in Ottawa has seen the data and has debated it, so we're going to give incremental antibiotics, additional antibiotics for patients perhaps with a risk score of 5 or 6 or above. We haven't finally decided, but about 10% of the patients will be giving extra antibiotics to. So I think it does need more validation. It's been internally validated, but it would be nice to validate it in a second population. We've already been approached by one large international registry to validate it further. The C statistic is already 0.704, which is higher than the CHAD score, for example, but it'd be nice to get that even better. So there may be a modified PADIT score evolves over future.
But nonetheless, you think that it does have a validity for immediate use?
Yeah, it's the first. It's 20,000 patients. It's got an endpoint that was independently adjudicated by 2 independent ID specialists. So it's certainly better than anything that we've got. These are solid data to say to the patient, there are these potential upsides, but you've got a 5% risk of infection, which is a huge downside. Patients who are on the fence as an indication or on the fence for personal reasons, this will be some nice data to show them, well, your risk is this.
Pros and cons. First, TYRX will reduce the incidence of infections in patients who have received CIEDs. Intravenous administration of cephaloxime before the procedure reduced the risk of infection by 81%. Cons. Patients who have received CIEDs may suffer infections, putting their life at risk. TYRX is not available in all countries, and where it does, have a very high cost.
My name is Eric Schwartz. I'm a cardiologist at Cardiovascular Specialists of Central Maryland, and I work at Howard County General Hospital. Another device that we have to offer our patients is something called an implantable loop recorder. An implantable loop recorder is basically a continuous EKG monitoring system that's implanted using a very small incision about the size of your finger right underneath the skin. It records the heart rhythm continuously for 3 years. There are abilities for the patients to activate them using a magnet that they put over top of it, so it will record a specific time. These devices look like typical flash drives that you would use for your computer. They go in quickly after about 15 minutes using a very small incision, usually near the mid part of the chest. The reasons that we give people loop recorders is a few. One is for people who have had passing out episodes that we can't explain multiple times usually. Another reason is for people who have palpitations that continuously occur that other monitors such as Holter or event recorders, which last anywhere between 24 hours and 30 days, have not been able to detect. Another reason that we've also decided to put these devices in is for people who have atrial fibrillation, which is another type of irregular heartbeat. That type of irregular heartbeat causes the heart to go very fast, and we need to monitor that sometimes. So these devices can record how fast the heart rhythm is going for long periods of time. The last reason that we've offered these devices to patients is for patients who have suffered strokes for an unclear reason. They've gone through all the testing with the neurologist and through their cardiologist, and they still haven't found out a reason for why they've had a stroke. The new data suggests that a lot of these patients may have irregular heartbeats that could contribute to their risk of having a stroke. And by giving them these recorders, we might be able to detect that. The device eventually comes out. It only lasts for 3 years, and then we remove it.
issue applied in Ecuador. In Ecuador, heart diseases are very common. They are first cause of death in the country. In 2017, they caused 7,862 deaths. However, in our country, collecting CIEDs cost between $7,000 to $50,000, causing few people to have access to them.
Infection is not something you can treat with antibiotics alone. It's the consequences of the infection that makes us really feel very concerned about it when it happens. To prove that there's an additional intervention, additional therapy that you can provide as a preventive measure and was able to cut down the risk by 40% is something really remarkable.
Unfortunately, this location works.
Conclusion. Adjunctive use of antibacterial envelope result in a significantly lower incidence of major CIED infections than standard of care infection prevention strategies alone, without higher incidence of complications.
Your heart pumps oxygenated blood throughout your body. Rhythmic electrical impulses inside your heart cause its muscular walls to contract, ensuring your heart beats steadily. If problems occur with your heart's electrical system, you may develop an abnormal, potentially life-threatening heartbeat called arrhythmia. Your doctor may want you to have an implantable cardioverter defibrillator, or ICD, to restore the heart's normal rhythm and prevent sudden cardiac death. During the procedure, your doctor will thread a small wire through a vein until it reaches your right ventricle. The wires continuously monitor the heart's rhythm. After verifying the wire is in the correct location and works properly, your doctor will attach the wire to the ICD generator. Then your doctor will insert the ICD device under the skin of your chest below the collarbone. The battery-powered ICD constantly monitors your heartbeat using a computer. If a life-threatening arrhythmia occurs, the ICD delivers an electrical shock to your heart. resetting your heartbeat back to normal. The ICD can also be programmed to pace the heart and restore its natural rhythm.
Thanks.